Have you clicked on this video confused whether if the symptoms you're experiencing are due to maybe your menstrual cycle being around the corner or maybe an early pregnancy symptoms? Well, you are in the right place. Let's start. Welcome to my channel. If you're new here, my name is Ilenia and I'm a midwife. I currently work in the United Kingdom and I've been helping for the past 6+ years women all around the world during their pregnancy, birth and postpartum journey. In this video we're gonna talk all about how to differentiate premenstrual syndrome symptoms to an early pregnancy symptoms. I have to do a disclaimer, everyone is different, so not because you don't experience any of the symptoms it means you're not pregnant, or maybe the opposite, because you're experiencing these symptoms it means you are pregnant if you're trying to avoid a pregnancy. So please bear in mind that everyone is different and a lot of women don't feel any of the symptoms during their pregnancy, or maybe they start to feel them later when they're 6-8 weeks, so it's absolutely normal. If you are dying to take a pregnancy test and you're just trying to understand if there are any other symptoms to look out for before, then we're gonna talk about those in this video. The first symptom that I want to discuss is implantation bleeding. What am I talking about? When the egg has been fertilized by the sperm, it's gonna roll into the fallopian tube and then into the uterine cavity. There, in order for it to continue and to proceed, it needs to grab into your uterine wall, into any part of your uterine cavity. At this point, your endometrium, meaning your uterine lining, is gonna be at its thickest, and the fertilized egg is gonna try to really dig a little hole into your uterine endometrium in order for it to implant. This causes a bit of bleeding. Usually is a pink, brownish bleeding, and it doesn't last more than a day or two. Where are we in the cycle? We are 7, 9, 10 days post ovulation. If you have a menstrual cycle that is a bit shorter, then you might confuse the implantation bleeding for your actual menstrual cycle coming up. So please bear in mind that it might be the same. However, if you just a little bit of spotting that suddenly stops, then it might be implantation bleeding, so it might be a symptom of an early pregnancy. Sometimes you can also have implantation bleeding with some cramps and some back pain. Sometimes you just have the back pain and the cramps and not the implantation bleeding. They're all symptoms of the fertilized egg trying to implant into uterine wall. Another symptom that is often mentioned by future moms is related to their breasts. The breasts, they become a little bit swollen and bigger, but more than that, they become super tender, to the point that even when you're putting a shirt on or when you rub accidentally against your nipples, they really feel like burning. And when you're running or walking, you really feel the weight of your breast. Especially if you don't have a big breast, you're not used to this sensation before and you do really notice. This might be a sign of early pregnancy. Now, as I said before, bear in mind that if you experience breast tenderness every time before your period, then this can be just a sign that your period is coming, and maybe it's coming a little bit earlier this month. But if it persists and it continues and it becomes more and more as the days goes on, then it might be a sign of early pregnancy. Let's now talk about all these minor symptoms that are mainly due to an increase of progesterone in your body that there is in the second half of your menstrual cycle. So again, those can be experienced regardless if you're pregnant or if you're just having your period in the next week or so. But usually if you're pregnant, they're a bit more highlighted and you are kind of forced into notice them. I'm talking about a bit of nausea, a bit of food sensitivity, a bit of change in what you choose to eat, and maybe some mood swings. Some women feel like very full of energy, others they feel absolutely tired, and they feel that they're sad in one moment and then absolutely happy in another moment. Those are all mood swings that can be due to the progesterone increasing in your body, so something to look out for. Those are the three mainly symptoms reported by women during the first weeks after, really days after conception. But other women do experience other symptoms that are unique. and they really vary according to pregnancy and to woman. Like some women might have a bit of headache, other can have a little bit of a cold. Like there really are various symptoms. So if you have experienced a symptom that I've not mentioned, please do pop it in the comments down below. I'm very curious to know what you have experienced in the first weeks after ovulation and after implantation. So after discussing all about it, now you're gonna ask me, when is the best time to take a pregnancy test then, if all the symptoms can be mixed with your period just coming, with your premenstrual syndrome? Well, it's a good question. Obviously, the most simple answer is the later the better. This is because the pregnancy test pick up something called the HCG levels, and these are higher after the implantation, and they are produced by your corpus luteum and a lot of things that I'm not gonna go into depth in this video, but you're not gonna be able to pick it up if you take a test too early. So the earliest you can take a test is probably the 9-10 post your possible ovulation. This is where you're gonna maybe start to see the test line becoming a little bit more dark. If you're taking like a urine test, if you're taking a digital test, then it's gonna be different. And then if you're taking the test again after a day or two, then you're gonna start to see this line becoming darker. Same if you're taking a blood test, then you're gonna see the level of the HCG increasing over the days. If the level of the HCG is stable or decreasing in your blood test, or if the line on your pregnancy test is not becoming darker, maybe it's just a chemical pregnancy, meaning a pregnancy that, like an egg that has been fertilized and maybe has dropped in the uterine cavity without being implanted, or maybe just a very early implantation that did not progress, and therefore you're not actually pregnant, but you just catched a very early pregnancy that was never gonna be evolving into an actual pregnancy, so it can be a little bit disheartening. So try to wait until 9, 10, 11 days post ovulation to be sure, and also kind of track the progression of the symptoms and of the HCG levels, or the darkness of the line. That is going to be more indicative of a pregnancy that is actually there and is staying there. To conclude, I want to mention that the pregnancy test needs to be taken possibly early morning with the first urine of the day. Don't take it like in the movies, like in the shower. Please do collect a urine sample in a little glass pot, whatever you have, and do dip the test in the urine. Leave it there for the time suggested in the packaging, and don't look at it too long, because you might see a line that is coming up just because you left the test sitting there a bit too long, and then therefore it can be a bit confusing. So do follow the instruction in the packaging and take it with the first urine if possible to have a most accurate result. It's all for this video. I know it can be a bit confusing, but I really do hope that it gave you a bit of peace of mind if you're trying to understand if your period is coming, or if maybe you are actually pregnant. I wish you the best of luck in this journey. If you're looking for a pregnancy, please make sure to subscribe, like the video, and I'll see you next time. Bye bye!